Good day, my dear undergraduate students. I welcome you to Shortcut to Spotters, in which I have included hematology. And look at the number, there is a skip lesion. This is a number which shall go back to others later on. The topic is Shortcut to Spotters. Look at this slide. I would like you people to make a diagnosis. Whatever be it first described, there is an increase in the leukocytic cells. And most of the cells have got two lobes of nuclei. But more important is the cytoplasm is not colorless. It is somewhat reddish or orangish red. This is called as brick red granules. The RBCs are there in the background. They are unremarkable. They are moderately large. The WBC is twice the size of the RBC, brick red cytoplasmic granules, and bilobe nucleus. Be careful, there can be three-lobe nuclei also, particularly in children. This is another slide of the same lesion. I find that there are many cells with two-lobe nuclei, but main point is brick red granules. Then only comes the nucleus. This is a neutrophil. These cells are larger. Therefore, your diagnosis will be eosinophilia. Remember, it is a spotter. This is the next one, in which I am finding multiple cells. There is an increase in the leukocytes. The cells have got granules, and the nucleus has got multiple lobes. Look at this one, 1, 2, 3, and 4. Whereas in this, it looks only like 2. And the cytoplasm has got colorless small granules. RBCs and platelets are unremarkable. But these cells are increased in number. Therefore, the diagnosis is neutrophilia. This can be a key diagram for us to draw. So this is another slide that can be given to us. In this one, I find that there is a marked increase in the leukocytic cells. The cells are small, almost the size of the RBC, and uniform in appearance. Only thing, a few cells are slightly larger as marked by the blue arrow. Many cells have got a smudged appearance. They are called the smudge cells or the basket cells or the smear cells. So it is a case of a chronic lymphocytic leukemia. So this is what is there. I'm finding uniform cells, some are pro-lymphocytes, and these are the smudge cells. The diagnosis is chronic lymphocytic leukemia. This is another blood film in which I am finding the RBCs are all appearing little pale and malnourished. There is an increased amount of pallor in the center and a thin rim of hemoglobinization. Cells are varying in shape also. These are elongated cells that I am seeing. So the RBCs are smaller than the lymphocytes. So microcytic, hypochromic, and anisopoikilocytosis. Teardrop cells, elongated cells, ring or the pessary cells. WBCs are normal, platelets are normal. The diagnosis is iron deficiency anemia. This is another smear in which I am finding large cells. Compare it always with the RBCs. They are 4 to 5 times the size of the RBC. This is the cytoplasm, grayish blue, and it has got, again, abundance. The nucleus is also large. These pale areas are the nucleoli. So it is a large nucleus, slightly convoluted in this case. In this cell, I am finding rod-like cytoplasmic inclusions. This is a myeloblast that we are seeing. The features are here. Increased nuclear cytoplasmic ratio, prominent nucleoli, etc. This is another case of the same diagnosis. I'm finding this rod-like inclusions, convoluted nucleus, prominent nucleoli, and abundant cytoplasm. So, this is a case of an acute myeloid leukemia. Thank you.